As one of your 3 Chester County Commissioners, I have the pleasure of setting the scene for our annual State of the County address. This is a chance to review, reflect, and report on the programs and services that our county government provides and how they impact and influence our many communities. This year, things certainly have been different. Chester County began the year with a new 3-member Board of Commissioners. We had plans for a transition that would review our government priorities and practices and establish our focus for the future. I had just barely worked out where to hang my coat. We toured the public safety training campus, attended the Pennsylvania Farm Show, and helped cut the ribbon on the new Exton train station. And all the while, the Chester County Health Department was mobilizing for action, preparing for a pandemic. So while I can say that COVID-19 was not in our plan, I can confirm that Chester County was prepared. Long before the coronavirus came to our region, staff in our health department began their planning, their preparation, and their communication. Briefings were held with long-term care facilities, our hospitals and first responders, schools and universities, the chambers of commerce, our businesses, nonprofits, and faith-based organizations, and our own Chester County departments and courts. Then, on March 12th, we announced our decision to enact Chester County government's Continuity of Operations Plan and shut down all non-essential services to help control the spread of COVID-19. We were the first in the region to announce this, to anticipate the need to take drastic action, and to lead by example. For just 2 weeks to begin with, or so we thought, we set up our Health Operations Center, supported by our Emergency Operations Center, and began sourcing what eventually amounted to 3 million articles of personal protection equipment. Chesco.org/coronavirus quickly became the go-to webpage for up-to-the-minute information and guidance on COVID-19. And the early weeks and months of this pandemic were packed with briefings and telephone town halls. With support from all Chester County chambers, the Economic Development Council, Chester County's township and borough officials, we reached thousands of small business owners and nonprofits, helping them to navigate their way through PPP loan applications and other federal and state grants. And through our Human Services Task Force, we identified gaps in food, housing, and human service needs, and worked with partners to meet those needs. We applied for and received $92 million in CARES funding, which has proved crucial in strategic funding for businesses, nonprofits, schools, childcare, and rental assistance. Chester County's business community has always benefited from thriving schools, vibrant urban centers, preserved green spaces, a solid structure for social services, and a focus on physical, emotional, and economic health. This pandemic has further reinforced how connected, how mutually reliant all of our Chester County communities are, and it shows that the state of Chester County is strong.
Unprecedented. Often this word has become overused, but it remains the most relevant word to describe the past 9 months. Vigilant. Another word used to describe our need to adhere to the guidance of wearing a mask, staying 6 feet apart, and washing our hands regularly. You're on mute. That certainly has been the quote of the year. But moving from words to actions, let me share some of the key initiatives that Chester County enacted this year to support everyone greatly impacted by COVID-19. Back in March, as positive cases started to appear, it became clear that Chester County had a distinct advantage when it came to infectious disease management. We have a wonderful, dedicated health department. Chester County is one of the few counties in Pennsylvania that has its own health department. And in times like COVID, this has been invaluable because local knowledge and expertise means more accurate and timely investigations, contact tracing, guidance, and support. Our friends and neighbors in Delaware County recognized this and reached out to us to ask if Chester County could stretch to supporting their residents, hospitals, and long-term care homes. It was the right thing to do, and we were able to do it. Marion already mentioned our many telephone town halls and actions to support all businesses that have received a direct hit from COVID. Those actions helped to address immediate concerns, but we knew that a more detailed strategy was needed to get our business community through this pandemic. So we quickly established the COVID-19 Business Task Force. In the short term, this led to Restore Chester County, the online resource providing guidance to businesses and residents on how to safely interact with COVID-19, how to reopen and stay open. Along the way, we visited our restaurants to give them support. We helped to bottle 125 gallons of hand sanitizer, and we ran an election successfully during a pandemic. Then we got purposeful with our CARES funding. $5 million in grants through our Main Street Preservation Grant Program helped nearly 250 small businesses receive grants of up to $25,000. $3.5 million was earmarked for Chester County nonprofits. $15 million in child care grants that so far have helped nearly 1,200 children in 140 child care centers. Funding that is meeting the pandemic-related education needs of 71,000 public school children across Chester County, and $2.5 million that has gone to our first responder organizations. Funding in all of these areas not only directly benefits our Chester County communities, but the ripple effects will help bolster our economic strength as we continue to make our way through this pandemic. We do look forward to a time when we have the vaccine available for everyone, and we are already planning the process of how to vaccinate everyone quickly. Should it be needed, we even have an ultra-low freezer to store the vaccine, thanks to a generous and timely donation by our friends at Longwood Gardens. When we pledged to prioritize the health and safety of every Chester County citizen back in January, we never pictured what that would really mean. These past 9 months have been tough, but it showed us that the state of Chester County is strong.
During the early months of COVID-19, Chester County saw a 70% increase in households being served by food banks. Our Decade to Doorways homeless prevention program transitioned residents in shelters to area hotels. We worked with landlords and provided CARES funding to help with rent costs. And we provided essential services for job seekers and employers, first virtually, then later moving to in-person. One other major increase in county services that we saw from the start of this pandemic was the use of our beautiful Chester County parks and trails. The true value of these preserved open spaces certainly was realized by thousands of our residents over the past 9 months. Of course, the business of Chester County government didn't come to a complete halt when COVID-19 arrived. And in many ways, it became more intense, especially in departments that come under our Human Service umbrella and our Department of Community Development. We are very proud of the way that county staff stepped up during this pandemic, those who were considered essential, as well as those who continued providing services from home. And our computer information services staff went into overdrive to make all of this happen. Now, alongside the management of this pandemic, Chester County is starting to move forward in earnest with its programs and services. Our Census Complete Count Committee promoted the importance of this year's census, and Chester County recorded one of the highest participation rates in the Commonwealth. We continue to implement the plans that meet our 6 goals of Landscapes 3, with activities like the Urban Centers Forum and important trail expansion plans. We committed $5.7 million to affordable housing projects across Chester County. and we have awarded more than $2.3 million in community revitalization grants that go to our urban centers. This includes $500,000 towards construction of the parking garage in Coatesville, which will serve regional rail riders for Amtrak and SEPTA users. And before you ask, SEPTA service is on schedule to return to Coatesville by 2022. Amid all of this, we continue with COVID testing, with case investigations, with following data trends, and with discussions on strategic mitigation plans to help us slow COVID-19 down. Our business task force is finalizing its short-term targeted stabilization of 21 industry sectors, with plans to move to phase 2 soon, focusing on broader, long-term recovery. Our strength in planning gives us a great advantage in moving forward economically. And the stepped approach we have taken to help businesses first steady the course, then move forward and grow, will help us to reshape our robust economy in a post-COVID-19 world. Our continual challenge, one that we face every day, is how to balance our public health needs with our economic and emotional needs. We know that our businesses, our restaurants, our schools, and our hospitals and long-term care facilities are in a better position now to control this virus, even with our numbers once again increasing. So it comes down to personal responsibility, which brings me to my final thought. Simple ask, wear a mask. This is the tagline to our friendly but firm public health campaign. Marion, Josh, and I ask you all to join us in this campaign by donning your own masks and sharing the simple message on social media. If you haven't gotten the message by now, despite the presence of a pandemic, the state of the county, whichever way you choose to measure it, is strong. Thank you for working with us to make it so.